is Shrija Reddy. I'll be your teacher for today, and our content will be talking about public health and its role. Let's get started. Have you ever wondered what happens when there's an outbreak like COVID or a natural disaster like Hurricane Katrina? Who takes charge and calls the shots on what must be done? Who's in charge of protecting the people's health? That's where public health organizations come in. So, a prominent figure of public health, Charles Winslow, defines public health as the science and art of preventing disease, prolonging life, and promoting physical health efficiency through organized community efforts. In simple terms, it's protecting and improving the health of the people within the community. Some renowned public health institutions that dedicate their efforts to the well-being of the public are the CDC, the Centers for Disease Control and Prevention, the Food and Drug Administration, the FDA, and the World Health Organization. The four main aspects of health are physical, social, mental, and emotional health. Physical health consists of taking care of your body with a balanced diet, sufficient exercise, and taking care of your immune system. Social health is setting aside time to take care of your relationships with your loved ones and friends, like attending some family gatherings or engaging in your community. Then there's mental health. It's widely associated with mental diseases like schizophrenia and depression, but mental health is a larger topic that involves broader categories. Taking care of your mental health by maintaining a consistent sleep schedule and taking breaks before burning out often helps people feel more productive and optimistic. Taking care of your mental health being is personalized differently to each person. Some people prefer taking power naps in the beginning, others prefer spending time with their pets, some just like to draw. Lastly, there's emotional health. Emotional health is our capability to deal with life events that could be traumatizing or exciting. Maintaining your emotional health will help you work productively and cope with the stresses of life without burning out. So, how did public health start? Did someone just decide to start a company in the 1900s and call it a day? No. The first attempt at public health was in 500 BCE, when the Romans and Greeks started to practice community sanitization measures with the Hippocratic sleeve, which was used to sieve water and have clean water. In the 1840s, the first Public Health Act of 1848 was established in the UK. In 1953, President Eisenhower and Congress created the Department of Health, Education, and Welfare. In 1970, the EPA, Environmental Protection Agency, was founded. In the early 2000s, the CDC and the WHO became the leading figures of public and global health. To understand public health's role, we need to understand what public health focuses on, how they protect our community's health. The three core functions of public health are assessment, policy development, and assurance. Assessment is when we collect and analyze information, making it available to communities. Policy development is when we make policies regarding public health. And assurance is when we make sure services are given without discrimination in race, ethnicity, gender, or socioeconomic status. Sadly, even though this is a core principle, there's still many cases of people not receiving equal medical treatment due to their socioeconomic status or race. Within these core principles, there are subdivisions. Under assessment, there's evaluation and monitoring health. Under policy development, there's informing and educating. And for assurance, there's enforcing laws and providing care. Now that we've had the public health principles out of the way, we need to know what determines the health of a community. The health of a community is based on genetic predispositions, social circumstances, environmental exposure, behavioral patterns, and healthcare in general. For instance, genetic predispositions could be people at risk for cancer or diabetic patients. Environmental exposure could be if you live in a heavily polluted area with lots of carbon emissions. Behavioral pattern is whether you're a heavy smoker or an alcohol addict. Healthcare could be simply if the person has access to healthcare, because some people don't. To better the health of the community, public health institutions created a graphical representation of different tiers of influence that are results from public health interventions. The base of the pyramid holds interventions with the greatest potential impact, like easier access to healthcare. The second tier is an effort to change negative lifestyle choices, like alcohol abuse or excessive smoking. It includes smoke-free laws and tobacco and soda taxes. Next is lasting protective interventions, which includes immunizations or colonoscopies. Then clinical interventions, such as controlling cholesterol and helping diabetic patients. Lastly, there's counseling education, which includes educating the community on nutritional and physical activity. Diseases are typically categorized in three groups: an endemic, epidemic, or pandemic. An endemic is when the virus or disease is present among a population or region at all times, with a relatively low spread, such as the flu or malaria. An epidemic is when there's a sudden increase in cases through a large population, like a country. The main thing with an epidemic is that it's more than expected and stays within a small geographic area. Some examples of this are yellow fever or the measles. Once the disease has a spike in cases and spreads fast through multiple continents and countries, it's classified as a pandemic. One example of a pandemic was a recent COVID-19. It spread from one continent to another and cases increased at alarming rates. Some ways public health has limited the spread was by making immunization policies at workplaces and schools, and depending on the severity of the disease, they'll put in different types of laws, such as traveling restrictions, quarantines, mask mandates, or even curfews. Some primary prevention services include vaccinations and disease prevention programs. Secondary prevention includes population-based screening programs for early detections of diseases and maternal and child health programs. Then there's disaster prevention. Public health and other healthcare workers come together and try to minimize death and injuries and prevent disease outbreaks and illnesses. They also try to provide relief to some people who come out with trauma, which are impacts from the shock and grief the victim suffers. Public health is also especially important right now because of its connection to climate change. A majority of the effects caused by climate change, such as air pollution, displacement, and water pollution. One thing that climate change can lead to is an increase in extreme weather events, such as heat waves, floods, and storms, which can cause physical injuries and mental health problems, such as PTSD, post-traumatic stress disorder. Some things they've implemented to reduce the effects are early warning systems, planning growth and development away from high-risk areas like flood zones, and developing evacuation plans to protect vulnerable populations. Climate change can also lead to the spread of infectious diseases such as the West Nile virus and Lyme disease. However, one of the largest organizations dedicated to public health, the CDC, are putting in efforts to reduce healthcare costs and trying to prevent these diseases from even entering the nation. These diseases are especially harmful as they can affect the nervous system and cause neurological disorders in the brain. Another problem is air pollution. Air pollution is often exacerbated by climate change and negatively impacts our neurological health. Exposure to air pollution has been linked to increased risks of developing diseases like Alzheimer's and Parkinson's, even cancer. To mitigate this, the EPA, Environmental Protection Agency, has passed the Clean Air Act, which is a federal law which regulates sources of air emissions. Aside from these, climate change can affect access to clean water and food, which impacts the overall health and leads to malnutrition and other health problems, which negatively affects neurological function. To diminish the effect, public health workers try to extend their resources to communities who lack access to clean water and food. Climate change can also cause displacement and migration, which leads to psychological distress and increased risk of developing, you guessed it, neurological disorders such as PTSD. Finally, climate change can lead to economic and social stress, which can negatively affect mental health and lead to an increased risk of developing neurological disorders such as depression and anxiety. In conclusion, public health is critical in extending life expectancy and improving the community of the health. By instilling measures such as fluoridation of drinking water, identifying tobacco as a health hazard, As these steps are taken, many communities around the world find themselves depending on public health. Remember to use the link in the description to answer the questions and get credit. Thank you for listening. We look forward to seeing you at the next lesson. If you have any questions, feel free to post them on the Google Classroom forum. Thank you. Bye-bye.